Welcome everyone to Breast Reconstruction Awareness Day 2024. I'm Dr. Jordan Jacobs. I am one of the plastic and reconstructive surgeons at Stamford Hospital. And I'm joined today by Dr. Cate, Chief of Breast Surgery at Stamford Hospital. And we are very fortunate to have one of our breast reconstruction patients with us who's going to answer some questions for us and tell everyone about her experience and really the decisions that she made and why she made them.
Hi, everyone. I'm Dr. Sarah Cate. As Dr. Jacobs said, I'm Chief of Breast Surgery at Stanford. We're going to be joined tonight by two amazing patients. The first is our patient, Sylvia, who's going to answer some questions for us and talk about her journey and just everything that she went through, which is really an incredible story. And I'm just so incredibly grateful to all my patients every day. I always tell patients practicing medicine is so incredibly humbling. And every day there are moments that you realize that you need to tell someone that, something is different in their treatment plan and it's unexpected and there's a change, and that's so hard to do. But I think it's really one of the things that keeps us humble and keeps us going every day as our patients, and we learn so much from them. So Sylvia, do you want to just introduce yourself and just maybe talk a little bit about your path in getting diagnosed and just sort of what happened to you this past year?
Yes. Hi, everyone. I'm Sylvia Larson. I am 42 years old, and I was diagnosed from a mammogram, which was on Good Friday, so it wasn't a really Good Friday for me. But I had been getting routine mammograms for a few years prior to my 40th birthday because I had extremely dense breasts. And at this stage, it was a different kind of day because you could tell that everything was a little bit more serious. And then from there, I was told to have a biopsy, which I had a little struggle with because there was a few issues with the location of where I had my calcifications. But I finally did get my biopsy done at Stamford Hospital, and they were able to diagnose me with breast cancer. But luckily I met Sarah Cate through I feel like I've been going to my general doctor for 15 years, and she's been amazing. And she told me how amazing Sarah was, and I agree. So I'm glad that through that relationship, I was able to meet Dr. Cate, and then through her, Dr. Jacobs. So it was really nice to have so many referrals through people I feel like have been wonderful to me. And then I was told that I needed to have a mastectomy, but only one-sided necessarily. And then through discussions with Dr. Cate and Dr. Jacobs, we discussed having the double because I had just only turned 42, and I think it's important for me. And at this stage of my life, like, I wanted to make sure that I was going to be happy for a long time and wanting them to be similar. And then we discussed like the different options, and then Dr. Jacobs said that he could do direct-to-implant, which honestly I did not even know that was a thing until I had a conversation with him, and it kind of changed my life and my thought of what this process was going to be about, because I thought everything I had heard was the grueling surgery, then the expanders and everything that came with that for the months leading after your diagnosis and your big surgery. And I have two young children who do a lot of things, and I didn't know if I could even handle that, which when he and Dr. Cate offered me this option, it was like life-saving, because not even 10 days later did my son graduate from kindergarten. So it was like a big deal for me that I was able to go, and then I didn't have to think about something else so big so soon. So that's where I am at.
Dr. Jacobs can talk a little bit about direct-to-implant and how it's really changed implant-based reconstruction, and we're excited to be offering this in Connecticut now.
Sure. Well, thank you, Sylvia. That takes a lot, I'm sure, for you to vocalize that. And you've been through a lot, emotionally and physically. Direct-to-implant started over 20 years ago now. And the idea behind it is quite straightforward, in that women who have sufficient skin coverage in order to accept an implant at the time that the breast tissue is removed by the breast surgeon can save one step in their reconstruction by bypassing a tissue expander, as you mentioned, the tissue expander being really the spacer, right, that can be inflated and deflated as needed. Well, women who have sufficient skin that's of good quality after the breast tissue removal, during the same surgery, we can go ahead and put the final implant in. And you're absolutely right. The implants, certainly achieve the best symmetry when they're both put in on the same side. On both sides. And I'm sure that was a tough decision for you, to make the decision to go ahead with a prophylactic mastectomy on the other breast. But like you said, you're very young. Luckily, you don't have to worry about this again, right? You've taken this off your plate, and you've achieved pretty good symmetry with just one operation. So we like to offer that to women who are good candidates. Obviously, not every patient's a candidate, but it's nice to be able to offer that, and we're really, really thrilled that you've done well and have had a good recovery.
So one of the things that we get asked every day is what to say to kids. And a lot of our patients, unfortunately, have kids that are young, kids that are teenagers. Like you mentioned, your kids are a little bit younger, but what exactly could you share with us to tell other patients that you told your kids what was going on? To what extent did they know that you were having surgery? What can you impart to us so we can share that with other patients?
So I really, I was stressed out about this quite a bit, but leading up to the few days before, the only thing we said was that I was going to have a surgery, but it was to take an infection out, and the doctors were going to just take it out and I would be better after that. And they honestly didn't really ask many questions because they were 6 and 8 at the time. So for me, I feel like that was a saving grace. But since the months passed, and it's ironic because we had recently watched a show a few weeks ago where somebody was talking about their mother who had passed because she had cancer. And he was in kindergarten, now he's in first grade. He goes to me, "Did you have cancer?" Out of the blue. And I haven't told them. And this was the moment where I was like, I don't know what to say. So then I knew I didn't want to not tell them the truth. So I said, I did. And he's like, "Oh, okay." And then we just moved on. But because October is Breast Cancer Awareness Month, and in the town we live in, they do a nice job with putting up a lot of little plaques on the window lights and everything in the town. Every time they see that now, because I've told them recently, I feel like they are a little bit proud because I keep saying it's like, mommy's strong, mommy's a warrior. But it was interesting because all they needed to hear was that the doctors were going to help me. I had an infection, I took it out, and that was it. And at their age, that was sufficient enough for them. But I know that as you grow up, there's a lot more questions. And I was grateful because my breast cancer was caught early and there was a good plan in place. So I didn't have to have the added stresses of more things to worry about telling them later in the line.
Yeah, that's incredibly powerful. And I think, we always tell patients, whatever age your kid is, there's different things to say. So I think just exactly how you handled it initially was the right way to handle it. And as they get older, they obviously find out more details. So what would you say you would want patients that are facing a similar diagnosis or a new diagnosis of breast cancer to know about any part of your treatment or your surgery, or what do you think would be useful for patients to know?
It's been 5 months since my surgery, and I feel like I've learned so much. And if I have a friend or a family member that were to have it now, I have so much wisdom or information to impart that there's basic information, even honestly, with like the level 0 to 4, so many people don't even understand what that means. And I feel like that's important to explain that to people going into something so scary. And that, along with the, if you have a lumpectomy versus a mastectomy and what that really means, I feel like that's important just to have some sort of like basic foundational information kit for people who are going through this to start off with, because you go in blind and it's very emotional and it takes you a while to like process the information. So for me, I feel like that would have been helpful, but like you learn along the way and that's amazing and that's how life is. But
and what made you choose Stamford for your breast cancer surgery and breast cancer care?
I had both my children at Stamford and I live in Fairfield County. So the proximity to where I lived was the easiest for my life. But what was the most ironic was I had traveled to New York, I had traveled to Westchester, and while those doctors seemed great and had a really good resume, there was something different about you and Dr. Jacobs that made me feel more comfortable. And I'm very glad that I had it at Stamford Hospital.
One common question, and you asked it in the office, and the patients think about, especially when they're going to have, lumpectomy, mastectomy, but they're going to have reconstruction on the same day, is really how long is it going to take to recover? What does that recovery look like? When do they get back to some sense of normalcy? Knowing everyone's experience is different. Can you just tell women about your recovery? If it was what you expected, maybe what you didn't expect.
Yeah, I think that one thing I guess I should have realized, but I didn't know, is you were very numb in that area. So it's almost a blessing because you don't feel much in that area. The aftermath wasn't as bad as I thought it would be. And I don't know what was all the factors. Like, you guys were amazing. Was it because I was younger? I don't know. But what I'm saying is my son graduated from kindergarten 10 days later. Not only did I get to go to his graduation, they have a little party afterwards with the entire grade and the families. And I was able to stay there for 5 or 6 hours. Yes, I sat in a chair and I didn't get to do much, but the fact that I got to enjoy it and he didn't have to leave early, and those things really that was the one factor that I was really worried about, and that we got to experience that day as basically normal, even though I had to hide my drains, fine. But other than that, it was the fact that I got to do that really made me happy. And then from there, I feel like once the drains came out, every day got better and better. And it is like an empowering thing to feel that like you had such a big thing happen in one day, the breast surgery, the reconstruction, and then going home and like being able to be with your children all in the same day. It's like, it's unbelievable that when I think about it, and some people are like, I can't believe that happened in one day. And I'm like, yeah, wow. Like, and I didn't even feel that bad the day I got home, to be honest with you. Like, I came home and my in-laws were like, wow, you're talking, you're sitting, like you're hanging out with us. And I was like, yeah, I'm fine. That the next day, maybe I was more tired, but it was a good recovery, better than I imagined it would be. And I think the whole process is super scary. So it's just something that, like, I know everybody's different, but it wasn't as overwhelming as the idea of cancer, and the possibility of what happens after the surgery is probably the bigger things that I worried about. So,
I think one thing that helps that Dr. Cate mentioned is while you're asleep, and sometimes it's us, Dr. Cate and myself, sometimes it's the anesthesia team, we do give targeted numbing blocks. We use a medication that is supposed to slowly release over about a 2 to 3 day period. So it really gets patients through the initial pain phase after surgery, which usually coincides with 2 to 3 days, decreases the amount of narcotic medication, which obviously has its own problems with it. So we're huge believers in the nerve blocks. We think it enhances the recovery of patients. And like you said, you went home the same day. Not every patient has such a quick turnaround. So we're really pleased that you did. But usually patients who are having an implant-based reconstruction will either go home the same day or they'll stay overnight. So I think with the nerve blocks, it really allows you to wake up after having basically 2 procedures and start getting up, start walking, start your recovery.
I was lucky enough to not need any chemo or radiation because of how early my cancer was caught, but also because my margins were good and it wasn't in the lymph nodes, and I'm really very happy about that. So I just started tamoxifen, and I've been seeing the oncologist at Stamford Hospital. My side effects have been, I guess, normal from what most people have with tamoxifen.
Okay, so we want to thank you so much for joining. Thank you so much for letting us care for you this past few months. And thank you for agreeing to talk to other patients about your experience.